Hello everyone, my name is Grace and thank you for tuning into my presentation. I was tasked with analyzing past flu seasons in the United States to advise a medical staffing agency as to how they should designate their staff for the upcoming flu season. My primary data sources for this analysis was the CDC's flu death rate, as well as the census data. And I'll be getting into how I use this information as we move through the presentation. But for now, let's just begin. So first of all, why do we need to prepare for the influenza season? Why is it important and what are we preparing for? Well, that's pretty quick and easy to understand by having a look at this chart down here. This outlines that between the years of 2009 and 2017, the US experienced on average about 70,000 deaths per year across all 50 states. The main variables, the main contributing factors of these deaths, for example, if a patient had a flu vaccination, whether they had pre-existing conditions or their access to medical care, is unknown. However, we do have control over one variable, and that's over the quantity of staff at a patient's local hospital. We know that if a hospital is adequately staffed, it has a major impact on the quality of care on both the incoming patient and the pre-existing patients, not to mention the quality of life of the medical staff that is already at that hospital. So we've already been able to outline the significance of this analysis and why it is worth doing. We can also, just as a little taster, we can see a list of states and the death rate across all of them for all years. And we can see that it's quite erratic, and we'll be diving into that more as the presentation continues. So let's start with our first question, our first focus being who. Who is most at risk of this disease? Who is most vulnerable and most likely to require hospital-level care? Well, the CDC has defined what is known as the vulnerable population for the influenza. And that is people under the age of 2 years and over the age of 65. And we can see from this chart down here that it becomes quite apparent that as soon as someone becomes over the age of 65, we can see the death rates of these age brackets as they grow older increase dramatically. So that is a clear indicator. Another note we can add is that this youngest age bracket is grouped into the under 5s. The CDC has not defined an under 2 years age bracket for privacy reasons. So those deaths have been chimed in with the under 5s. However, if there was an under 2 age bracket, it would be just above this bar and no doubt be higher a death rate. So we've identified the age brackets, but what is their relationship to each other? What is the ratio? We can see in this pie chart up here that we have the death rate of the vulnerable population is near 2.5 to 3 times that of the rate of the non-vulnerable population, which is quite a dramatic difference. And to add even more perspective on that, we can know that the vulnerable population makes up what is almost 20% of our total population. However, they account for almost 70% of flu-related deaths, meaning that they are disproportionately impacted, and very clearly a group of people that we should be focusing on for this analysis. This is also incredibly helpful to know as we are able to cross-reference these age groups with the US Census data, which can give us an idea about where these people are living, and therefore what hospitals could be more impacted. But we'll get onto that in a moment. First of all, I wanted to understand when. When is the flu season, and when can we expect to see this impact on our medical care system? Well, thankfully, the flu season has a very distinct season. It runs from the months of December all the way through to March and has been pretty consistent over the years. This might not be surprising, as it could be commonly known that the influenza is regarded as a winter ailment. However, in contrast to that, we can see that on this map, although this is a winter ailment, it is in fact some of our warmer states that are hit the hardest, which asks the question, how does climate play a role in the influenza season, when we have some states like California, Texas, and Florida being heavily hit, and other states such as Alaska, Montana, etc., having very low levels of flu season? We can see that up in the Northeast, places that do have reasonably cold winters do have higher numbers of deaths by flu. However, the population density of these regions are also in relative to the California, Texas, Florida, etc. So there's some inconsistencies there. We're not able to see a pattern or a correlation between what is a climate or a locale. We know that there's a season, but we don't know how that relates to location. And that is what we will be moving on to our next slide. Where are these vulnerable populations? We know who's impacted them, and maybe it's where they live that shows where these death rates are, and that is proven through this map here. So we can see that the death rate is indicated by the darkest shade of blue. The darker the blue, the higher the death rate. And we can see that the total vulnerable population, as indicated by the darker, redder dots, corresponds directly with the death rate. So we can be assured that a state's climate has no impact on a state's death rate, it's more that the density of the vulnerable population has its biggest impact on why a state has a higher death rate than others. And this is sort of seconded in this chart here that we can see. So with all of this information in mind, we've outlined who it is that's impacted, when we can expect to see this influx of patients, and where those populations live. With this information, we can inform where we should be designating our staff. We can also see here that our forecasted death rate for the upcoming year of 2018 for the influenza is pretty consistent with its previous years. Now, hopefully, with this analysis and further research, along with appropriate preparation, we can bring down that death rate across the nation. Thank you very much for watching my presentation.